It's estimated that 1 in 4 adults suffer from a diagnosable mental disorder in a given year, which can be caused by a plethora of risk factors, including genetic inheritance, environmental events, drug abuse, and childhood trauma, amongst other things. Today, we're going to look at some of the rarest mental illnesses out there. But first, click that subscribe button and hit that notification bell as well. Reduplicative amnesia. This first mental illness is like a terrible form of deja vu. When you're subject to it, you think a place you're in has been duplicated. It's complicated to explain, but some experts put it this way. The mental illness always includes the sufferer being convinced that a location exists in 2 places at once. Paris syndrome. As the name implies, this mental illness is all about Paris. It happens when tourists go to the French city and become obsessed with it. According to the mental health experts at Online Psychology Degree, it affects more Japanese people than any other. The website states that of the approximately 6 million Japanese visitors to Paris each year, 1 to 2 dozen experience the overwhelming anxiety, depersonalization, derealization, persecutory ideas, hallucinations, and acute delusions that characterize Paris syndrome. According to the same experts, the mental illness is probably caused by the language barrier, physical and mental exhaustion, and the reality of Paris as compared to the idealized version. Factitious disorder. Most people just hate getting sick. The sniffles, the total feeling of dread and helplessness, ugh, it's the worst. Well, for people with the mental illness factitious disorder, it might be the best. Yes, these people love being sick. In fact, some of these people will intentionally make themselves ill in order to receive treatment. Or they just might pretend to be sick, making up symptoms and attempting to get help at hospitals. Such an obsession with sickness often stems from past trauma or serious illness. Dissociative identity disorder. This illness, named Dissociative Identity Disorder, or DID for short, is one you might recognize from movies and TV. It's characterized as an illness when you have multiple personalities, and it's a really bad one to have. The ones who suffer from it usually have 2 to 3 different personalities, and will often cycle through identities at random times. They could stay as one person for minutes before moving on to the next, or it might take as long as years. Clinical lycanthropy. There are some people on the internet who believe they are otherkin, which means that they are an animal trapped inside the body of a human. We don't judge, we live in a free country, and you can think whatever you want, but these people might be suffering from a mental disorder called clinical lycanthropy. Like another mental disorder on this list, keep watching, they just keep getting more and more interesting. The people who suffer from this illness think that they're animals, or that they can turn into animals. In the case of clinical lycanthropy, it's usually wolves. Usually, they'll be found in the woods or in fields, acting like some creature from nature. Boanthropy. This is a mental disorder that dates back to biblical times. Apparently, a king named Nebuchadnezzar was described by the Good Book as being someone who was driven from men and did eat grass as oxen. As that passage implies, sufferers of this mental disorder think that they are cows. They often are found in fields with other cattle, eating grass and walking on all fours. Scientists, like with many other mental issues, aren't sure what causes this affliction, but they think it may have something to do with dreams or even hypnosis. Would this technically be considered clinical lycanthropy? No, that's wolves and other animals, except for cows, apparently. Wendigo Psychosis. This modern medical term, which is inspired by Algonquin folklore, surrounds the legend of the Wendigo, a cannibalistic monster or evil spirit. Psychiatrists consider Wendigo psychosis to be a form of culture-bound syndrome, a combination of psychiatric and somatic symptoms. Those suffering from Wendigo psychosis are said to experience intense cravings for human flesh and the fear of becoming a cannibal. Alice in Wonderland syndrome. This neurological condition affects perception. which means those who suffer from it experience a disorienting reality, including size disorientation. This syndrome is often associated with migraines, brain tumors, and the use of psychoactive drugs. Alice in Wonderland syndrome can be in part caused by a migraine and can affect one's sense of vision, their sense of touch, hearing, sensation, as well as body image. Symptoms of this syndrome are known to arise particularly at sleep onset and due to lack of sleep. Alien hand syndrome. This condition involves a person feeling like their limbs are acting seemingly on their own and are unable to control the actions. Those afflicted can find their limb unintentionally reaching or manipulating something to the point where they have to restrain it. Alien hand syndrome commonly affects the left hand and is best documented in cases where a person has had the two hemispheres of their brain surgically separated. Klüver-Bucy Syndrome. Resulting from bilateral lesions of the medial temporal lobe, this syndrome can make sufferers feel the urge to do inappropriate things with inappropriate objects. There can be a hyperorality syndrome that comes with Klüver-Bucy syndrome, which makes those afflicted have a compulsion to examine objects using their mouth. Cotard Delusion. This rare mental illness results in the affected person to have a delusional belief that they are already dead, do not exist, are decaying, or have lost their blood or organs. This symptom of mental illness was found to exist in 69% of the cases of Cotard syndrome. However, 55% of the patients studied in the 100-patient cohort presented delusions of immortality. This syndrome results in the afflicted being unable to make sense of external reality, which prompts them to have a distorted view of the external world. The delusion of negation is usually found in psychosis with sufferers who are also affected by schizophrenia. Fregoli Delusion. This rare disorder makes sufferers idealize the notion that many people that they encounter are actually the same person in disguise. The syndrome is believed to be related to a brain lesion and is often of a paranoid nature. Psychiatrists associate the delusion to a breakdown in normal face perception. Not only does this affect the sufferer's perception of identification, but it also affects their memory, which can result in recollection of places and events being mentally replaced. The Fregoli Delusion is classed as delusional misidentification syndrome, which involves misidentifying people, places, or objects. CapGras Delusion. This disorder prompts the afflicted to believe that someone close to them, either a friend, spouse, parent, or close family member, has been replaced by a seemingly identical imposter. Similar to the Fregoli Delusion, CapGras Delusion is classified as a delusional misidentification syndrome, and it can occur in acute, transient, or chronic forms. Despite how much a loved one may plead to the sufferer, the afflicted will remain convinced that the person is an imposter. The most common cases of this delusion are with patients who have been diagnosed with paranoid schizophrenia, but it has also occurred in patients suffering from a brain injury and dementia. Stockholm Syndrome. This psychological condition can occur when a hostage begins to develop sympathetic feelings towards their captors. Those experiencing Stockholm Syndrome can begin to share their captors' opinions or start to feel romantic feelings towards them, a bond which can happen due to the amount of time spent together. Diogenes Syndrome. This disorder is characterized by extreme self-neglect and can result in sufferers hoarding rubbish or animals with a lack of shame. The elderly are the most susceptible to Diogenes syndrome, and those afflicted generally feel alone and withdraw themselves from society, filling a void with whatever they can find. Apotemnophilia. This neurological disorder is characterized by the intense urge to amputate a specific limb, but it can also make sufferers feel the need to become paralyzed, deaf, or blind. More recently, the psychological disorder has become recognized as Body Integrity Identity Disorder, BIID. Sufferers can be completely sane and rational but have a strong desire to sever a healthy limb. People afflicted by this mental illness will sometimes seek surgeons to perform their desired amputation, or will deliberately injure the specific limb with the intent that forced emergency medical amputation will be necessary. Some neuroscientists have idealized the notion that this neurological disorder is caused by an incomplete body image map in the right parietal lobe. And that completes our list of rarest and most interesting mental disorders. Did you learn a thing or two? Maybe we missed one of the most interesting ones. Why don't you share your experience with these exotic mental disorders in the comments section below? Enjoyed this video? Hit the like button and share with your friends. Also, subscribe to our channel for more videos like this. Thanks for watching.